Diabetes has become one of the most pressing health challenges of the modern world, and nowhere is this more visible than in the United States. Once considered a disease of limited reach, diabetes has now spread across every state, every city, and every community, affecting millions of lives. Today, more than 38 million Americans live with diabetes, while millions more remain undiagnosed. Even more alarming is the fact that over 95 million Americans are believed to be prediabetic, at risk of developing the disease in the near future. These numbers reveal not just a health issue, but a social and economic crisis that continues to grow with each passing year. At its core, diabetes is a condition where the body either cannot produce enough insulin or cannot use the insulin it makes effectively. Insulin is essential because it helps regulate blood sugar, turning it into energy that fuels the body. When this system breaks down, blood sugar rises to dangerous levels, leading to long-term damage to the heart, kidneys, eyes, and nerves. In the United States, both type 1 and type 2 diabetes are found, but type 2 is far more common, linked heavily to lifestyle factors such as diet, physical inactivity, and obesity. The reality of diabetes in America goes beyond statistics. It affects families, communities, and generations. For many, it begins silently with small signs such as fatigue, excessive thirst, frequent urination, or blurred vision symptoms that are often ignored until the condition becomes severe. By the time some people are diagnosed, complications like heart disease, kidney failure, or nerve damage may already be present. The disease does not discriminate. It affects young and old, rich and poor, but it is particularly harsh on vulnerable groups, including minorities and low-income families. The financial burden is staggering. The American Diabetes Association estimates that the total cost of diagnosed diabetes in the United States has soared past $400 billion annually. When combining direct medical expenses and lost productivity, families often face high costs for medication, blood glucose monitoring, insulin, and hospital visits. Beyond money, however, lies the emotional toll, parents worrying about their child's health, workers struggling with fatigue on the job, and elderly patients fearing the loss of independence due to diabetes-related complications. One of the most worrying aspects is the rise of diabetes among children and teenagers. Once called adult-onset diabetes, type 2 diabetes is now being diagnosed in younger populations at alarming rates. Sedentary lifestyles, fast food diets, and the widespread availability of sugary beverages have made obesity and insulin resistance more common among American youth. This trend raises difficult questions about the future. If children are developing diabetes so early in life, what health struggles will they face by the time they reach middle age? Despite these challenges, there is hope. The United States has some of the most advanced research institutions, hospitals, and treatment technologies in the world. Scientists are working tirelessly on new medications, improved insulin delivery systems, and even artificial pancreas devices that could transform diabetes management. Public health campaigns are also trying to raise awareness about the importance of diet, exercise, and regular checkups. Simple lifestyle changes such as maintaining a balanced diet, engaging in daily physical activity, reducing sugar intake, and monitoring weight can drastically reduce the risk of type 2 diabetes. For those already diagnosed, adherence to treatment plans and healthier living can prevent severe complications. There is also a growing conversation about food culture in America. Many experts argue that the overconsumption of processed foods, sugar-laden snacks, and oversized portions is a major driver of the diabetes epidemic. Schools, communities, and policymakers are increasingly called upon to play their part by promoting healthier food Options: limiting sugary drinks and creating safe spaces for exercise. Change on a societal level is not easy, but without it, the disease will continue to spiral out of control. At the same time, diabetes is more than just a medical condition, it is also a test of resilience. Across the United States, millions of individuals live full, productive, and inspiring lives despite their diagnosis. From athletes who manage their diabetes while competing at the highest level, to parents balancing treatment while caring for families, to young innovators developing new health technologies. Countless stories prove that the disease does not define a person's potential. Ultimately, the fight against diabetes in the United States is about more than numbers and medications. It is about people. It is about protecting the health of future generations, reducing the enormous financial strain on society, and ensuring that every American has the chance to live a long and healthy life. While the road ahead is challenging, with awareness, education, research, and collective action, there is still hope that the tide can be turned. Diabetes may be one of the greatest health challenges of our time, but it does not have to be the story of America's future.